Unit 7, Integumentary System. Many times when people think of the integumentary system, they think of skin, but it really is more than just the skin. It consists also of the hair and the nails, the glands, the fatty tissue, and the nerve endings. So our integumentary system is our natural protective covering. It is a sense organ. It regulates body temperature. It's very important in its role. Some of the normal changes of aging in the integumentary system would be that you have sagging skin, and that's from the amount of fat and collagen that decreases. We lose elasticity. The elastic fibers lose elasticity, which causes wrinkles. Hair and nail growth slows, and then the skin becomes drier and thinner. We're also more prone to lacerations and skin tears, and we bruise more easily as we age. The elderly tend to feel cold more than they do hot, and that's because those protective fatty layers start to thin, and then the hair thins and turns gray, and that's another normal part of aging. Be familiar with what shingles is. Shingles is a viral infection. It's caused by the same virus that causes chickenpox, and it can be very painful. The rash can be very itchy. Sometimes you have fever and chills. Here's a picture that you can look at of what shingles virus looks like. Be familiar with that. After a certain age, oftentimes shingles vaccine is recommended. So immobility is something that we need to be aware of. When an elderly person stops moving as much, there is certainly issues to the integumentary system that can happen. So immobility causes a decrease in the blood that circulates to the skin. They're at a higher risk for skin breakdown, and usually that breakdown will occur over the bony prominences. Now, we've already checked off on side lying position, so you know how those bony prominences have to be supported with the pillows, like the knees and the ankles. So this is kind of what they're talking about. So there's the bony prominences, and we talked about that as the area of the body where the bone lies close to the skin. And then there's pressure points, and these are areas of the body that bear much of the weight when sitting or lying. So like a pressure point you can think about would be like the coccyx, or if you're laying on your side, maybe like the ear could be a pressure point, just depending on how you're laying. Here's an image that can show you, if laying on the lateral side, everywhere that the arrow points are areas of pressure. And so that's a good image to look at. Pressure ulcers can be called pressure sores, bed sores, decubitus ulcers. These are all interchangeable. They all mean the same thing. There are 4 stages of pressure ulcers. And there's a good video I want you to go and watch in the video section about pressure ulcers that will talk about some of this too. But stage 1 is when the skin is still intact. And so there's redness at the area, or it can appear blue or gray, and the skin can be swollen or feel warm or firm. And then that redness or discoloration is not relieved within 15 to 30 minutes after removing pressure. So if you go and you roll somebody on their side, okay, they were on their back, and there's some redness, and you come back and check them in a 15 to 30 minutes and the redness is still there and it doesn't go away, that might be a sign of a stage 1 pressure sore. A stage 2 is partial thickness skin loss, so that it may look like a blister or a shallow crater. And sometimes there's pain with that. There's skin around the pressure ulcer, and it can start to become discolored, but there's no dead tissue yet at this stage. Stage 3 is full thickness skin loss, and there's an ulcer that looks like a deep crater, and there may be some yellow dead tissue at the bottom of the wound. This is something that's going to take a really long time to heal, and it can start to really have a nasty odor to it. Then stage 4 is where it's all the way down to the muscle and bone. There is dead tissue, necrotic meaning dead. Healing takes months. Sometimes surgery is required and skin grafts, and there could be serious infections. It's really horrible when it gets this bad. And it can happen very quickly. It can start out as a little blister, and the next thing you know, they've got this deep, deep wound on their body. So we have to really be aware and be watching and do things to prevent this from happening. So let's talk about some of the risk factors. What makes a person more at risk for having a pressure ulcer? And that would be immobility, so not moving as much, laying around a lot. Wrinkled linens, so if the sheets aren't pulled tight, those wrinkles can actually cause breakdowns. Crumbs or irritating objects in the bed, malnutrition, urinary incontinence. Okay, so if they're wet, that skin is going to be more prone to break down. So we want to make sure we're not allowing them to lay in wetness or a wet bed for extended periods of time. Be familiar with the terms shearing, friction, and then understand the role of moisture with skin breakdown. There's a good picture here that talks about shearing and how, like, when a person scoots down in the bed and the skin moves but the bone stays fixed and it breaks the little vessels. That is an example of shearing. In that video that I put in the video section that hopefully you'll go watch, there's some really good information about shearing and friction. And then the last part of this lecture is about prevention of pressure ulcers. And so if you see a change in the skin, and a great time to look at changes in the skin is when you're bathing, when you're dressing, things like that. So look, if you see a change in the skin, you want to report it. You want to make sure you're always looking. You want to keep their skin clean and dry. You want to make sure you're turning them every 2 hours if they're not able to turn themselves. If they're sitting in a wheelchair all day, make sure they're changing their position, and then watch for rubbing skin against surfaces during transfers.